to screen yourself from the cancers which can happen during menopause, the uterine, the breast, and the cervical cancers.
The changes that happen in menopause are real. Skin changes and hair changes both take place.
Due to the hormonal changes during menopause, your bone mass and bone density decreases, which leads to an increased chance of osteoporosis and osteoporotic fractures.
It is a natural phenomenon. Don't worry about it.
Be positive, happy, enjoy it, eat right, exercise, and then you will feel these are the best years of your life.
Women and girls constitute half of our country's population, yet gender disparities remain a very critical issue in India. Unfortunately, women's health issues as well as biological processes have been shrouded in secrecy and shame. May 28th is celebrated as Menstrual Hygiene Day, a day to spread awareness on menstrual hygiene and highlight the importance of this. But today on Menstrual Hygiene Day, we're not talking about menstruation. We're going to be focusing on something else which is equally important, which is menopause. And people in our country are not talking about it. Menopause is that stage in a woman's life when she stops having her menstrual periods. Unfortunately, shame and stigma come with both, whether it's when a girl starts her periods with menstruation or whether women suffer in silence when the symptoms of menopause start today. There is lack of dialogue, and to talk about this so that we understand what the symptoms are, how women cope with menopause, we have with us today, let me start with Dr. Siddhant Narula. He's a bone and joint specialist, Fortis Hospital, Gurgaon. Thank you for joining us. We have Dr. Pushpa Sethi, senior practicing gynecologist, National President, Indian Menopause Society 23-24. We have Dr. Sachin Dhawan, Director, Skin and Smile, Gurgaon. Also Senior Consultant Dermatologist, Fortis, Gurgaon. Thank you for joining us. We have Dr. Vandana Narula, National Chairperson, Indian Menopause Society. Thank you so much. And we have Dr. Ashok Taneja, Cardiodiabetologist, National President-elect for Clinical Cardiodiabetes Society of India, as well as an organ transplant expert of patients. So let me begin with you first, Dr. Sethi. You know, the Indian Menopause Society has been here for nearly 3 decades. Do you see a change happening, and how urgent a need is it to spread awareness on the symptoms so that women don't suffer in silence and they can actually share this with their friends, families, and speak about it openly?
Thank you so much. And definitely this is a phase in a woman's life which she has to pass through. She may not pass through any other problem of infertility, obstetrics, any other problem, but yes, menopause is a stage she has to pass through. So Indian Menopause Society has been there for almost 28 years now, and we have been working tirelessly to bring this message to every woman that the changes happening in her body at this point of time, she has to understand them. They are associated with certain problems like the vasomotor symptoms, hot flashes, changes in her bone strength, psychological changes, changes in her vaginal mucosa, urinary infections, and so on and so forth. And she has to be made aware that these problems, she has to talk to her doctor. They are not supposed to be borne in silence. And all the changes, if we guide her properly as regards her lifestyle management, her changes that are happening and how she has to take care of them, the life that she lives beyond 47 years can be a really healthy one. And she can, that is the time when, you know, she's doing well in her profession, and she wants to do a lot of things that she could not do otherwise. And that is the time only she can utilize if she is healthy and she knows what she's passing through and how to manage it.
Okay, so before we actually move on to experts who are going to help us understand how to cope with the symptoms, Dr. Vandana, what age do women normally, you know, I mean, there's pre-menopause and, you know, post-menopause. If you can explain that, and what really is the age, so that in the 40s, a girl or a lady is kind of, she knows what I will go through when you're going to reach that stage in your life.
Basically, the age of menopause in our country is around 45 to 47, extendable to around 50-52 years. Okay. So all the symptoms of perimenopause, the period where the menopause is approaching, would be around after 35 or 37 years, and after 40 she may have certain problems associated with menstruation, and if she is careful in that period, the menopause is going to be a smooth sailing later on. And once you get a menopause, and then the golden period where she can manage her symptoms is around 5 to 6 years, where if she is very careful, the rest of the menopause is going to be a good one.
So I'm
that
going to
way.
take it from your point, what you said, where she's careful. So we're going to move on to experts, starting with the heart. What is the connection that when a lady is going through a menopause or approaching that stage, how does menopause affect a woman's heart?
See, one thing should be made very clear to everyone is that post-menopausal period is a natural one. It is not a disorder, number one. Number two, keep it in mind, when there is a post-menopausal period, there are certain changes in the hormonal levels in the body. Estrogen comes down, there is a chances of insulin resistance and chances of renal hypertension, getting more of blood pressure.
Okay.
One. Secondly, when there is a change in the insulin levels or it is not acting properly, it will raise the blood sugar levels. These all leads on to more of atherosclerosis. That means the blockage inside the arteries of the heart, which leads on to heart problems. That is why the incidence of heart problems in the post-menopausal period will increase comparatively.
So it's important to get regular checkups done. I think that,
Yes.
that really is key. It's more of a prevention.
The key is the prevention.
Absolutely.
One, your diet. Second, regular exercise. And number three, smoking and other factors.
I think those are some important points. We're going to be talking about exercise, but something I think skin and hair, I think for all us women, skin A is the biggest organ in the body. And for women, of course, more I feel, skin and hair is very important aspect. How does menopause affect skin and hair of women? Because people do tend to complain that, my hair is falling or, skin is becoming wrinkled.
Basically, menopause affects you from tip to toe, starting from the hair to the skin to other body areas as well. The reason for that is that the relative reduction in estrogen that takes place, and whether it is skin cells, it is hair cells, it is color producing cells, oil glands, sweat glands, they all have estrogen receptors. So as the levels reduce, the sweat production reduces, skin becomes dry, it gets lines and wrinkles as a result of it. Because it is dry, you also get more prone to getting allergies, because if you don't have hydration in the skin, external allergens can enter and they can create a reaction, an allergic reaction. Then hair, of course, on the head become lesser, something called female pattern hair loss, and on the facial, hair growth tends to increase. So either hirsutism, which is thick hair, develop, or hypertrichosis, which is thin facial visible hair, develop around the perimenopausal age group. Around 42 or 43 it starts to develop. Then as vasomotor changes we spoke about earlier, people get hot flashes on the face, rosacea can be triggered,
Okay.
facial sensitivity can be triggered. This is also a time when people experiment a lot with products like anti-aging products, retinols, etc. Instagram is all full of it.
Yeah.
A lot of us actually come back to us saying that this reacted and that reacted. So that accentuates the barrier breakage which happens naturally as a result of lack of estrogen. Typically tip to toe everything can change if care is not taken.
So we're going to come to the care part after the break, but before we move on, another very important aspect is your bone density. I was reading somewhere, Dr. Siddhant, that bone density I think goes down about 10% within 5 years of menopause. Tell us about it. Is it true or is it just a myth, and how does one deal with this?
No, yes, because of the hormonal changes as mentioned by Dr. Taneja, the bone density decreases because the estrogen level falls down. So during the menopause and around the perimenopausal time, the bone density decreases. And there are ways to counter that. One of them is maintaining your muscle mass. Maintaining the muscle mass will help in maintaining the bone density. Other than increasing the fibers in the diet, you have to increase your protein intake, which is very important. So your muscle mass will be determined by your protein intake also. One of the things is that decreasing bone density also makes you more prone for fractures.
Yeah.
So that is also important, because in elderly fractures, they take more time to heal and they cause a lot of morbidity.
So your bones definitely are weaker. You need to take extra care.
Yeah. Also, one thing more, every woman in the perimenopausal area should get a DEXA scan. A DEXA scan is something that tells you about the bone density.
So no, thank you so much. In fact, we do have viewers wanting to ask. Thank you for explaining, I think, the symptoms. And now if we move, how to deal with it. We have our first viewer. Kanchan, please go ahead with your question.
I am Kanchan from Delhi. I am also suffering menopause position. But during this period, my family didn't support me. They feel I am sick, but I am not sick. I think it's a part of the life. But I am going to depression nowadays, because they feel they didn't cooperate me anyway. So tell me what to do.
See what happens when you enter the perimenopausal age, then the menopause and then the postmenopause. Psychological changes are very, very important, part of the whole plethora of changes happening during this time. Psychological changes means patient feels depressed, there is loss of sleep, there is loss of self-esteem actually, and coupled with the fact that at this time the children are out, they are gone to colleges, husband is busy in job, she is lonely, something they call the empty nest syndrome. So at this point of time, it is not only the medications that are important, it is very important that the whole family understand what she is going through. She is not sick, she is undergoing a change which is very, very inevitable.
Yeah.
And the family support is more important than the medications. So family support, letting her do some work. She should not be free all the time. You know, you're free all the time, you get more into depression, you don't sleep at night, and it becomes a vicious cycle. So the family support is very important. She should take up any job. If not a job, she can go into a social service.
So on that note, we're going to be taking a very short break. I think so the family needs to understand that's not only answering Kanchan's question, I'm sure many women across India do have the same feeling. Stay tuned, we're going to be talking on this topic after the short break. Welcome back. You're watching a special show on menopause today on Menstrual Hygiene Day. Yes, we're talking about menopause on Menstrual Hygiene Day. Dr. Taneja, how should one take care of their heart during this phase? I mean, you did say prevention is cure, getting checkups. What other tips would you like to give our viewers?
I always say detox.
Okay.
Detox your body, detox your mind. Body detoxification includes your diet. Diet, your carbohydrates should be cut down, oil should be cut down, protein should be increased. Remember one thing in the diet, increase more of fibrous things, number one. Number two, avoid white things in the diet, I always say.
Yeah.
White means refined things, not curd and yogurt.
Yeah.
Refined means your refined salt, your refined sugar and refined flour. All three are detrimental to the health of the heart. Increase your exercise level, that is another way of detoxifying.
Okay.
And the exercise has to be aerobic, not yoga. Yoga will come for the detoxification of the mind.
Sure.
For the body, it has to be aerobic exercise. 10,000 steps per day is considered to be the ideal for any man or woman to have a good, healthy exercise level. Number three, smoking. Smoking should be absolute zero. Fourth, many people or many patients, they ask me about the role of alcohol. Alcohol should be in limited quantity.
So basically lifestyle changes, I
Yes,
think is key. I
yes.
think that's a very important aspect, and that should start anytime. I think menopause, of course, you should be more thing, but it should start anytime. Just coming on to skin and hair again, something big, like doctor said, you know, to Kanchan, what she was answering about the psychological aspect. You know, when women come to you during their 20s or 30s, when they start visiting you, when they come during this phase, do you feel that change psychologically? Do you feel that, you know, they're having anxiety issues because they may not be looking the same what they looked few years ago?
So you're exactly right. You know, psychological changes do happen in women. I see women who may have been coming to me from the 20s and 30s, and when they enter their 40s, you can see a visible change in their appearance, despite all the good work that we have been doing with them. The right time to start procedures would be before the changes set in. Like typically late 30s is the right time to start. Start with something very basic and natural, like a platelet-rich plasma therapy injection. Start by taking good skin care regime.
Okay.
And then gradually, as the years progress, you can keep adding other procedures in. If I talk about prevention and what to take care of in this age, there are 4 things that I would suggest. Number 1 is lifestyle changes. Number 2 is dietary changes. Number 3, supplementation, and then the procedures would come in.
Okay.
So lifestyle changes, of course, good sleep.
Like Dr. Taneja, yeah.
Good sleep is very important. 8 hours of good sleep, less screen time, make sure stress levels are lower, and exercise and physical activity is there. In terms of alcohol as well as caffeine intake, one should try to keep it to the minimum. Smoking is an absolute no-no. Then in terms of procedures, additionally there are procedures which are energy-based devices like high-intensity focused ultrasound. We have radio frequency based devices which firm up your skin. Because the most visible changes that happen is skeletization of the face. The face becomes slightly shrunk when you achieve menopause, and you need to volumize it by adding moisture into the skin internally.
Okay, so again, I think going back, I mean, most important is initially, I think, lifestyle. And again, what we said, the family support is important. I would just like to come to you for that, Dr. Vandana Narula. Do you think the menopausal health demand is a priority in Indian women today? Do you actually feel a family coming and telling you, or a son or a daughter saying that my mother is going through this? Do you see that shift? Because you've also been you are a part of the Indian Menopause Society.
Yeah, that's what we want to convey to the society, that people are living longer. So longevity has increased, and many women would have so many years into menopause. Earlier the women were not that, the longevity was not more, so now women are living to the age of 80, 90.
Yeah.
So many years, 30 to 40 years of their life they would spend in menopause. And that message needs to go in, that you have to start early, start with the whole family. The counseling has to be done with the whole family, that yes, this is going to happen, and this is how you can as family support the woman really. The children can support, the husband needs to know. So if the family is supportive, then you have a good group of friends you can relate to. And like in Menopause Society, we have a Club 35, which we have promote in a big way, where we connect women at this age, around 35 plus, and let them mingle around, discuss their symptoms, and teach them also what they will have later in life. Like if we stress they need to start calcium, vitamin D then and there, then it is going to help them in later life. So we connect those women at a social level. Family
so that
support
they all
comes
understand
in.
that they're all going through it, and it's a normal thing. I
Normal
think because
process.
we're talking, our conversation today is, I think, about normalizing the conversation. Just again going back to, you explained about the bone density and to, get the DEXA test, scan
DEXA
done.
scan, yeah.
But how can one prevent osteoporosis? Because we see a lot of women, when they're approaching that stage, they have it. Of course, you said calcium and vitamin D, but any other tips you would like to give our viewers?
Osteoporosis is just not calcium and vitamin D. It's the bone matrix which decreases. Okay. So other than the 10,000 steps that Dr. Taneja said, one thing extra that needs to be added is strength training, which is quite neglected, especially in women.
Yeah.
So strength training will help you maintain your muscle mass, help you maintain your posture, your balance, everything, prevent falls, and maintaining your muscle mass will automatically help in increasing your bone mass.
I'll just come to you, Dr. Dhawan. Something I missed out is on prevention again, on cancer screening, and we do have a viewer question. Please go ahead and ask.
I would like to know if menopause increases the risk of cancer, and what are the screening tests that we can do as a precaution?
See, normally after 40, every woman should undergo a mammogram. Maybe twice, once in 2 years. But if you have a family history positive, like your mother, your maternal aunt or your paternal aunt having breast cancer, they should have it done every year. Okay. But after 50 years, it should be done every year till at least the age of 75 years. Okay. Then coming to cervical cancer, after 40 again, every 2 years you should get a pap smear done. And that should be also followed till the age of 70, 75 years. And then these are the two main cancers that the preventive check is done. But coming to the endometrial cancer, whenever you have a intermenstrual bleeding or you have a post-menopausal bleeding, see 1 year when the period stop, you are supposed to have entered menopause. But after entering menopause, if you again have bleeding, then there is a high suspicion that you may be having a endometrial cancer. So every 1 year at least, get a routine ultrasound lower abdomen done. That will also tell you the condition of your ovaries, whether there's something some changes happening there. Because ovarian cancer, is a cancer that one doesn't really know. You come to know of it when it is already very far advanced.
And I think again we're going back to first it's awareness, we talk about it, then we know our symptoms, and then when you know it's preventable, you can work towards it. Before we wrap up, I'm going to come to all of you. I'll start with you before we wrap up, Dr. Vandana.
It is the breast self-examination which needs to be taught to every woman. Okay. That is like if they stand in front of a mirror and we can teach them steps how to examine their own breast, then half of the cancers can be prevented. Not all would go for a mammography or ultrasound breast. So when they feel there is a little lump or there are changes in the size or the nipple or some discharge from the nipple, they have to report to the doctor.
No, I think those are some important points. Thank you. Dr. Taneja, what would your closing remarks?
One liner I will like to add for the postmenopausal women.
Yes, please.
Look at your waistline. Always.
Always, yes.
Waistline should not cross more than 35, 36. It is a marker of central obesity.
Obesity.
And central obesity is the main pivot for creating all the troubles, metabolic troubles, like rising of the blood sugar, blood pressure, as well as the cholesterol levels. So always remember, your waistline should not cross 35 in females. It is true for men also. They should not cross 40. but female in post-menopausal period, it is very important to check.
See what
Okay.
happens in the post-menopause because of the falling estrogens,
Yeah.
the body fat gets redistributed. So they'll all come and tell you, I had a very good waistline, suddenly there's, it
Yeah.
has gone. Because there's a redistribution happening. So you have to be very careful that you eat proper, you exercise properly so that your waistline remains in
Remains
check,
safe.
because otherwise you are
Yeah.
in for all the metabolic problems.
And then you get into
as
more
Dr.
serious
Taneja has
issues.
said. Yeah.
Dr. Dhawan, your closing remarks, and you wanted to say something.
Yeah,
please.
I wanted to emphasize upon the need for supplementation for hair and skin. So for hair, things like biotin, collagen, vitamin E would be important. Similarly, for the skin also, collagen would be important. Omega-3 fatty acids would be important.
So again, a prevention.
Preventive care.
And closing remarks from you,
And
Dr.
supplementation from the orthopedic side will be, you have to keep your vitamin D once a week or maybe once every month. Have your calcium, exercise regularly, not only cardiovascular exercise, strength training. Yeah,
I think
that's it.
I've definitely learned that because I think strength training, women normally do
Neglect-
not want to go to the
Yeah.
gym and pick up weights.
Stress on that once we talk to women
Right.
around in this age group, that you have to do a weight training twice a week minimum to build up
So
your
it's
bones.
indeed been a really, I think I've learned a lot today, and I'm sure all our viewers have learned a lot. Thank you for putting it that so simply, because these things are doable. I mean, first, again, I'm just going back, it's about awareness, the family needs to support, it's about understanding your symptoms, and then very easily you can cope once you know what your symptoms are. Thank you so much, doctors, for joining us, Dr.
Thank you.
Taneja, Dr. Vandana, Dr. Dhawan, Dr. Sethi, and Dr. Siddhant. Thank you all so much. It was a pleasure to have you with us.
Thank you so much.